Hi, we're really lucky this evening to be joined by Professor Clare Rusbridge. She's Chief of Neurology at Fitzpatrick Referrals. Clare's time is really precious, so I'm so grateful to her for joining us. The aim of this evening's Facebook Live is really to help owners to understand Chiari and Syringomyelia, help them with diagnosis and treat the dogs in their care. Over the last 2 years since setting up the rescue, we've had a lot of dogs come into us with very obvious pain symptoms. Consistent with Chiari and SM. Some of them came to us because they were due to put to sleep. So really, we're really passionate about this issue. And I'm going to hand over to Clare now, the most qualified person on the subject, who's helped us manage many Cavaliers in our care and really given them a good quality of life.
Thank you, Becky. So tonight we're going to really talk about 4 main things. The first is, what is this condition? And I would say that if you need a bit more information about it, then we published a paper this week. And the aim of this paper, unlike many of my scientific papers which were based on research, the aim of this paper was actually just to review information and to provide everybody with a source of information about this disease that was in an easy to read format. And so the aim actually is to make a guide for veterinary surgeons in practice, and many owners may want to read that as well to get some more inside information, although obviously it's written for a vet and it's quite technical. And the other aim is for people who are training to be neurologists, so they have one source of information. And we have to thank the website and health fund associated with that, which is cavalierhealth.org. The health fund associated with that funded the open access, which is many thousands of pounds, just so that it's available for Cavalier owners. So those wanting more information, have a look there. So today what we're going to talk about really is, what are these conditions? They've got horrible words, and it's very difficult to imagine what they are sometimes when they've got such difficult to pronounce monikers. We're going to talk about the clinical signs, and we're also going to talk about what signs aren't associated with Chiari malformation, because there's a lot of misinformation out there. And finally, we're going to discuss the common ways that which they're treated. I'm not going to go into surgery at this point, because that really is at a referral level and would be discussed individually. We're going to talk about medical management. So one of the things that makes it so difficult to understand Chiari malformation is that it isn't a black and white disease. It's not binary. You don't have it and you don't have it in very many cases. It really is like your MRI scan, many shades of grey. And we now divide dogs that are of breeds or breed crosses that are predisposed into 4 different groups. And the reason for this is Chiari malformation, the condition of skull shortening, is ubiquitous in some breeds, meaning that if you were to take an MRI picture of them, then you would see it either mild or more severe in every single example of that breed, because their head shape predisposes them to the problem. So in some breeds, like Cavalier, King Charles Spaniels, Maltese, Chihuahuas, to a certain extent Yorkshire Terriers, those ones with an apple head, these breeds have it ubiquitously, so they pretty much all have it. So we see 4 different types. The first is Chiari N, or normal. So these dogs that have a degree of the malformation, or should we say just shortness of the skull, but they're a completely healthy dog. They have no clinical signs of pain. And then we have dogs that have CMP, or pain. So these are dogs that live with clinical signs of pain. Then we have dogs with Syringomyelia. Now, dogs with Sphingomyelia, it's perfectly possible for Sphingomyelia to be very mild and not specifically associated with any signs. I describe it as being like a donut. I mean, a donut with a hole in it is essentially a cake. It still fulfills its cake-like functions, but it has a hole in it. A mild Sphingomyelia can be like that. It's a small hole in the center of the spinal cord, and the rest of the spinal cord is around that hole, And although there may be some damage to it, it essentially functions normally. And then we have SMMS, and that's where they have specific signs of syringomyelia. And this is where they have a wide syrinx, so it's damaged a lot of the spinal cord, and they have specific signs of phantom scratching, scoliosis, and what we call postural deficits, which means weakness, and we'll discuss that later. So that's the 4 types. As I've alluded to before, really the risk of Chiari malformation is very much associated with head shape, so much so that you can look at some breeds and say whether or not at risk. And you can see this tricolor Cavalier here on my left has a very low risk of having the disorder just by looking at her, and we know that she doesn't have the disorder, and we know that her puppies don't have the disorder. She's Chiari normal and has been MRI scanned up until she's a very elderly dog. And the reason why she doesn't is that she has this very traditional head shape. So you can probably see my little arrow here. She has a tapered muzzle coming up here, and a long muzzle, and a fairly long skull. So if you were describing her, you say that her skull was longer than it was broad. Whereas at-risk head shape for Cavaliers is unfortunately a rather cute head shape. They have a much shorter muzzle, and they tend to have a right angle like this, and their eyes and their general facial features tend to be clustered together, and you could almost put your finger in the hole between their eyes, and that's an at-risk head shape. So sometimes it depends on what they look like, and that also is true of many of the other breeds, and perhaps the answer of how to get rid of it. But it would be a bit of a game changer, because it would really mean that people would want to have to desire this, what I think is rather a beautiful looking dog, over a little cutesy over here. So this is actually a Chihuahua, and it shows you in a simple way what is Chiari malformation. It's a very complex disorder. Some people, quite understandably, actually describe it as a cerebellar herniation, but that's really humans. In the dogs, we recognize now a whole variety of different malformations, and these are 2 Chihuahua siblings. And you can see when you compare them the difference between the 2 dogs. This dog has less of a Chiari malformation than this dog. First of all, you probably think that this one looks a bit grayer and less defined, and that's really because you can't see the CSF space, the cerebral spinal fluid space around the brain like you can the other dog. And this is because the brain floats in cerebral spinal fluid. It sits in a sac called the meninges. People have mostly heard of meningitis, but they probably don't know what the meninges is. And it's the sac the brain sits in, and it floats in fluid. And generally, the dog with Chiari has less fluid about it. And that is important, because that fluid helps to buffer it from pressure changes. And so these dogs are very susceptible to pressure changes. And these can be little things like when you lift the dog up underneath the armpits, a dog with Chiari will often yelp, although they may not show any other signs of pain. So less fluid to float in, less protection from pressure changes. And they also are pushed in at this region, and they lose these bits of their brain associated with smelling, the sense of smell, which is the olfactory bulbs. You can just see them very tiny here. And they also change in angles. So you can see this angle here of the skull base versus the neck becomes a much more acute angle. The stop changes into a right angle. If it's a Chihuahua, then they'll get a much bigger morella, the open fontanelle. And in all of them, they get a much greater height, a sort of domed head, really, as we were looking at the pictures. And then the back of the skull becomes much shallower, and the cerebellum often pops out. And in the case of the Chihuahua particularly, and the Yorkshire Terrier, you get this kinking of the brainstem, which is very important with whether or not they have Syringomyelia. And so this picture, which is super complicated, but there's a reason why it's super complicated, and it's really to show you all of the different changes that happen with Chiari malformation. So there's lots of different changes, and this is why it's so difficult to look at an image of a dog with Chiari malformation and say for sure two things: to say for sure whether or not the dog has pain, or say for sure whether or not the dog is going to get Syringomyelia, which is this white here, which symbolizes fluid within the spinal cord. And that's one of the things that we're working on from a research point of view, is looking at all of these different features with the computer and trying to make a computer prediction about those things to make a better breeding scheme. And this is the Cavalier, and so we can see the different features here. This is the normal dog. We can see this is pushed in here and pushed in here. We've lost the white around the brain, except we've got more in the center, which is big ventricles. And when we have the King here, which is very important for whether or not they get the Syringomyelia. And this is the syrinx here. This is the whole spinal cord. And we can see the fluid builds up first in the neck, and then it often builds up in the lower part of the spinal cord. And a good MRI study will include all of this. And that's something I'm very proud of at Fitzpatrick's, where I work, is we don't just image the head, or we don't just image this area. We image the entire dog and get the best picture that we can of what's going on. And the other thing that's very important to do when you're imaging is to take a cross section of where the syrinx is widest and look at how it's damaging the spinal cord. And this sort of asymmetrical syrinx here, which is wide, is much more likely to be associated with problems. And this dog is much more likely to be having SMS or Syringomyelia signs. And the syrinx develops, we're not too sure, but we think it's because of obstruction of the CSF flow around the spinal cord, and fluid gets forced into the spinal cord and damages it. And what's the most common sign? Well, it's pain. And this is a picture of Molly before and after medication. And I think all of you who keep dogs can be able to say that this is a very different picture to this. This is a relaxed looking face. This is a screwed up, worried looking face. And a facial grimace is a sign of being worried, I guess, in a dog, but also a sign of pain. Facial grimacing is not always recognized in the dogs, but when you see it, it is one of the more distressing signs. What are the other signs? About 65% of dogs with Chiari-associated pain, and bear in mind this is with or without Sphingomyelia, so it doesn't matter they don't have a syrinx. Most common sign that people report is vocalization, and the most common vocalization is yelping when being picked up. Some dogs will have spinal pain, about 1 in 2, and that can be most commonly in the neck, but it may be lower down as well. And it's unlike disc disease, it's not specific. So with disc disease, if I was to press on the area where the disc is herniated, then I would be able to say quite precisely, yes, there is pain there. Whereas in Chiari malformation, it's often a more diffuse pain. In fact, when you put their hands on their neck, they go like that. They sort of react in a kind of twitchy way. About nearly a third of them are reported as scratching or rubbing their head or their facial area or their ears. Now, this is not phantom scratching. Phantom scratching is something very different. And this has to be borne in mind that dogs most commonly scratch their ears because they have an ear problem or a itchy ear. So actually the diagnosis that this is due to Chiari malformation associated pain is one of exclusion, and one that you make after you have given a trial for skin and ear disease. And also in conjunction with all of these other signs. So refusal or difficulty doing jumping or doing stairs is seen about a third of a dog. A behavioral change, becoming more anxious, withdrawn or aggressive, is seen again in almost a third of cases. Aversion to touch, so the dog quite classically may be very happy for you to groom it everywhere except one ear. or one side of their neck. Being disturbed at night. Very important differential for this, though, or possibility for this is breathing problems because of BOAS, or brachycephalic obstructive airway disease. So the behavioral change is something that is particularly important to people working in rescue. So we're going to dwell on that a little bit more. And the reason for that is that a change in behavior, especially if you're a Cavalier, because after all, what do we expect of Cavaliers? We expect them to be super friendly, placid, good family dogs. So a change in behavior is really probably less acceptable in some breeds than it is in others. I mean, one doesn't necessarily be that surprised if a dog, which is a Mastiff breed, for example, bred for guarding, is aggressive. One sort of expects it, but we don't expect it in the Cavalier. And this little picture here is an example of a video, a freeze frame sent to me. The video was sent by the owner, created actually because the vets, all the vets associated with this dog, had great difficulty in believing that she was aggressive at all, because she was simply a sweetheart in every other situation. But she had a 4-week history of growling and going to bite when her owner went to stroke her head. No other signs of aggression. I have to ask you the question, if you had a headache and I kept on coming up and stroking you on the head, what would your reaction be? Well, quite simply, your reaction probably would be, if you're a polite person, would be to tell me to stop. Please, Claire, don't do that. I've got a headache. I want to be by myself. In fact, I'm going to go off and sit over here in my bed in a quiet, withdrawn way. If I then followed you when you were withdrawn to the quiet corner where you could get away from people, and kept on trying to make you interact with the family, how would you interact then? Well, you probably get a bit cross. You probably shout at me a bit. And if I still kept on doing it, well, you'd escalate your response. And the answer is that probably this dog tried to communicate she didn't want to be touched in a very passive way. But it wasn't interpreted, it wasn't understood, and not because the owner was stupid, but because the owners, us humans, don't read dog very well. We don't speak that language very well, and so the dog escalated her response until she actually was understood. And other things that people report as they become more fearful of strangers. They may have more fear in unfamiliar situations and loud noises. They may be described as more clingy. They may be described as more excitable. Persistently yapping is quite a common sign, attention seeking. And this is really because pain affects your outlook on life. And really, it's a whole different subject in itself. Pain really is associated with a different mental outlook and how you deal with things. Anybody who is in pain will tell you that. So, our other signs. Well, if it is Syringomyelia, which is wide, and so what I'm talking about is where it's really occupying most of the spinal cord. So the spinal cord is the grey here. The rest of it is the rest of the dog, really. This is the brain here in cross-section. And all this white here is fluid within the spinal cord. And really, you can't even see the outside edge of the spinal cord. It's less than 1 millimeter thin. You can see it in cross-section here. When that gets really wide and when it goes right to the outside edge, then we get this thing called phantom scratching. And it's a very specific scratching. You can trigger it by rubbing a certain area. And it's also triggered by excitement and walking. And often they don't make contact. It's sort of called doing the air guitar. And if you have a syrinx like this, you may also become twisted, getting a scoliosis. And they may have weakness. So this dog here, she was actually much improved with physiotherapy. But you can see how dipped her spine is because she has got such poor core strength. And this dog is scraping his foot, so-called proprioceptive deficit, because he's not picking his foot up properly. So how do we diagnose specific Syringomyelia? Well, really, it comes down to the width of the spinal cord. And we also need to know that the syrinx explains the neurolocalization. So, for example, I've seen sometimes that Syringomyelia is being attributed to seizures. It can't. Syringomyelia is a disorder of the spinal cord, and seizures come from the brain. So Syringomyelia cannot cause seizures. So the problem is that Cavaliers get quite a few things that if you did an MRI scan of it, you wouldn't see the cause of it. And I've got some examples here. So I have to thank Cavalier Health for the images in some of these pictures. But for example, degenerative myelopathy is a disease a bit like motor neuron disease, doesn't have any changes on MRI, and it's the most important cause of Cavaliers becoming paralyzed in their back end. Epilepsy doesn't have changes on MRI scan. Fly catching also doesn't have changes on eye catching. Facial nerve paralysis or Bell's palsy, very common in Cavaliers. Vestibular disease, very common in Cavaliers. All of these don't have changes on MRI scan. They're so-called idiopathic, which means normal structure. And so if the vet sees a great old syrinx there, that may be just completely incidental to what the dog has. It may also be causing signs, but not these ones. And of course, Cavaliers can also get intervertebral disc disease, and that's an important other cause of pain and perhaps paralysis in dogs. So those are the clinical signs, and I wanted to spend the last 10 minutes talking about treatment. And this is a bit of a super complicated slide again. And for those of you who are thinking, oh my goodness me, well, there's two ways you can make life easier for yourself. The first is to get that paper that I showed you before. And the other is to go to my website, which is veterinary-neurologist.com, and you can download this treatment algorithm, which is quite useful actually for taking to your vet. Some vets don't like having information presented to them. I think those are in the minority. I can remember when I just graduated, just graduated, and a dog with a rare skin condition came in, and the owner said, "This is what my dog's skin condition it is," she said, handing me a raft of treatment. "It's already had a diagnosis. I've printed this out because I don't think you will have read about it." And boy, was she right. I had definitely not heard about that in vet school, and I was super pleased that she very kindly thought to educate me and also provide some treatment. I think you've got to be pretty arrogant as a vet if you think you know everything, and I think the vast majority of vets are very pleased if owners are able to help, as long as the owners don't present it in a way that is making the vet feel like this. When we look at the treatment, we have to look at the different problems that we get. First of all, we get pain, so CMP. Then we get the phantom scratching, and then we get the gait abnormalities and the weakness. So I'm going to deal with those first because unfortunately they're the most difficult to deal with. Really, those represent pretty serious damage to the spinal cord that is unlikely to be repaired. It's like loss of nerve cells. However, you can augment what you've already got. So my first line of treatment with those is actually to refer to a physiotherapist and a hydrotherapist. I tend to refer to a physiotherapist first in the hope that they will also use a hydrotherapist because I do think the two go together, and just throwing the dog in a pool is not the best way to do it. I will, in some instances, consider surgical management for those. I will sometimes use drugs which reduce the production of that fluid, the cerebrospinal fluid, and the logic for that is to try to turn off the tap to stop the bath filling. So if you imagine the tap is the CSF being produced, it's produced in the center of the brain, and the bath is it going into the spinal cord. In reality, these drugs probably work in the short term, but not so good in the long term. So I don't tend to use them long term unless after a treatment trial, the owner is telling me that these dog drugs are definitely helping their dog. So we'll do a trial, and they'll often help with pain, but they won't necessarily help with the weakness. And you'll see down here that corticosteroids are often very effective for this in the short term, but they're not sustained. And to me, putting a dog on corticosteroids for the rest of their life is not a good option, especially if they are 2-year-old dogs. And I can tell you that actually this will have as good long-term outcome as this. In fact, this will have a better long-term outcome because ultimately corticosteroids cause muscle wastage and weakness. So phantom scratching, well, the scratching is due to damage of a certain part of the spinal cord, and the spinal cord that is being damaged uses a neurotransmitter called glutamate. Glutamate is the neurotransmitter of both pain and scratching because they've both evolved in a similar manner, and that's why there's the comparison that gabapentin is used for both conditions. We often use gabapentin as the starting drug for this. So what happens is it dampens down that signal, and the dog reduces their scratching behavior, hopefully. The other choice that we have is pregabalin. Pregabalin binds to that receptor affecting glutamate release, binds with more affinity and lasts for longer. Some people say, why didn't you go to pregabalin first? I could, but it's more expensive. And it's generally a bit more of a hassle to get because you often have to write a pharmacy prescription for it or order it from a chemist yourself, which increases the expense. So most vets stock gabapentin, most vets don't stock pregabalin. So that's why that order is. And then after that, there are some other medical managements. We're running a trial at the moment for dogs with a confirmed diagnosis, but that would require a referral for that. With Chiari malformation associated pain, I often do start them on non-steroidal anti-inflammatory drugs. If you've not heard of that term, NSAIDs, you may have heard of the drugs. There are things like Metacam and Rimadyl and Simuljex and Onsior and Galaprant. All of these drugs are in this class. They're not super good, super powerful painkillers, but they are painkillers without sedation. And so if there is some positive effect, then I think it's worth trying to establish that. It also should be said that some dogs with Chiari pain are not in pain all the time. It's not necessarily 24/7 for some dogs. Some dogs will go through periods of being painful, and then for inexplicit reasons, it just seems to go away again. Humans are the same. So it's not necessary medication for life. After that, we switch to gabapentin to reduce that glutamate, that neurotransmitter of pain, and we also can switch to pregabalin. And then we're in trouble really, because it becomes much more difficult to manage pain. And I imagine it as being a bit like stopping sheep escaping from the field. Pregabalin is gabapentin shutting the gate. But if the sheep are diving over the broken walls and diving through the hedges, then it's not enough. And so then we tend to use add on different drugs. And this is where my diagram gets really quite complicated. And we aim for as few as possible. So what I'll tend to do is to do a 2-week trial of drugs that can be evaluated in 2 weeks, which is like gabapentin, pregabalin, and topiramate. All of these other ones, like amantadine and amitriptyline, require 2 months worth of trial for the levels to build up. So they're quite long-term things. And all of these drugs are affecting neuropathic pain. I will often use paracetamol for top-up pain, and that's because some dogs seem to be able to forecast the weather better than Sky television. And when the weather becomes either a rapidly dropping pressure or a rapidly changing pressure, or it's very hot, or perhaps very cold, then they may get an exacerbation in their symptoms. And you don't want to be popping them on a drug that's going to take 2 months to take effect. You may only need to top up their existing medication. Although paracetamol seems a very basic thing, I quite like it because most owners can get hold of it, even if it's at a late night pharmacy. And paracetamol has an action through cannabinoid receptors, and it has a central action. And so that's possible. I'll also, if it works, use complementary therapy such as acupuncture, because hey, if we can use pain relief without having to use drugs, then that's a good thing. And I'll also sometimes use my CSF reducing drugs. I very rarely, if ever, use corticosteroids for pain control. And of course, the big old question that everybody has wants to ask is, do I use CBD oil? And the answer is actually no. The reason why I don't use CBD oil is dosing it for pain requires so much of the drug. It makes it, one, it's super expensive, and two, the dogs become sedated, and so very similar side effects to this. I do think it has a role. I'm just waiting for a preparation that allows us to dose it properly. And you're probably saying, oh, you know, I give a few drops. Well, a few drops usually contains, excuse me, as I understand it, about 5 milligrams per drop. And a Cavalier, well, any dog requires about 2 to 3 milligrams per kilogram twice daily. So if you work that out, should we say the Cavalier is 10 kilograms? So that's 25 milligrams. So that would be 5 drops twice daily. So it's possible to do with a Cavalier, much more difficult to do with a bigger dog. But when the bottles are costing something like £60 for 65 mgs in a bottle, that becomes a very expensive medication. So you're using, in some instances, some of those low dose bottles, you'd have to give half a bottle a day for the dogs. So that's why. For those vets that might be watching who wanted to know the drug dosages for that, that is the Dosages. I suggest you take a photograph of it. Or look it up in a formulary, because that would be the correct thing. The only thing I would say for the vets is the amitriptyline dose that I use is much lower than the formulary, because I build up to it slowly. And I think I'm exactly on time. And I'm going to just end by saying that the research that I do has been funded by many people, and all the information I'm giving you couldn't have been possible if it hadn't have been for many dog owners who have been raising money for this research. And some of the charities there are also listed, and I really have to acknowledge them. So over to you, Becky. Do we have any questions, or have I been speaking to just you?
No, you have lots of questions. Okay, really important one. So it's from Judith. Our breeders screening for this?
Oh, hi, Judith. Well, I would have to say a few breeders are screening for this. We have a screening scheme in the UK, but I would say there's been less than 5 that have gone through it this year. Now, some of that will be due to COVID, of course, but less than 5 this year. So I would say it's probably less than 30 a year in this country. Some people would say they might be using unofficial screening schemes, though they're an unknown quantity. Basically, the breeder can do this. They don't have to share the result with anybody. They don't have to share the result with you. They can just say the dog's been screened. And the people reporting it are not usually radiologists or neurologists. They're usually what we vets would call certificate holders, and not in MRI, in orthopedics. So it's the unofficial screening schemes are really that unofficial. In other countries, so in Holland, for example, and in Belgium, it's compulsory. You have to. And as a result, they're seeing a decrease in the prevalence of this disease, as you might expect. In Scandinavian countries, they are also doing it breed club wide, and they're probably the biggest users of the BVA scheme, the Scandinavian breeders, because they don't have an official scheme in their own country. So the answer is, disappointingly, breeders are not screening for this. There are problems with the screening scheme in that what breeders would like is a very binary answer. Yes, no, your dog's got it, your dog's not got it. The trouble, and at an early age, the problem with it is that if you were to screen 1-year-old dogs, about 25% of the dogs that are going to get Syringomyelia have Syringomyelia at that point. And so it's frustrating for the breeders to do it and not know the absolute result for their dog. So I kind of get it why some of them don't do it. However, we have to look to our companions in Europe and say when they are doing it, they are seeing some results. So it's the best that we've got.
Okay, the next question is from Clare Petch. How many dogs die from this?
So Claire, that's a good question. And the answer to it is that actually it's not fatal in that it's going to kill you like heart disease sense. So the answer is many dogs live with this and they live in pain with it. And that's what we have to recognize, that actually when they die from this, it's because people have made a choice that their quality of life is unsatisfactory. And the answer to that, how many dogs are euthanized from that, from about 3 very small studies, is about 15%. But it's very difficult to get very, very accurate figures from that. So the important thing is to know is that we need to recognize the signs from this and treat it. And that actually the biggest cause of death in Cavaliers is is mitral valve disease, but that doesn't mean that it because it has a low mortality, that it doesn't have a low that it doesn't have a high morbidity, which means number of animals affected.
Okay, so this is Sammy Wood. You mentioned they don't do well with pressure. My dog has SM. Is he safe to fly on a plane?
So Sammy, this is a very common question, and actually it's a very common question from humans with Chiari malformation and Syringomyelia. And the answer is that the cabin is pressurized, so it should be okay. And no human or dog, to my knowledge, has reported an exacerbation of signs with flying. But one does wonder sometimes about the pressure changes as you're going through turbulence and the ears and that sort of thing, especially with some Cavaliers with glue ear. But I would think the glue ear would be more problem than the Syringomyelia.
Okay. Question from Diana. What is the long-term prognosis of a dog diagnosed with Syringomyelia?
So again, Diana, that's a very good question. About 3/4 of the dogs with pain associated with Sphingomyelia and Chiari malformation will show progressive signs. So that means that their signs will get worse as they get older. But a good proportion of those, the owners report that they can be successfully medically managed. So only, as I said, only 15% of them end up being euthanized because the owners consider the quality of life being too poor.
Sandra Knight, I have, sorry, all the comments, there's so many comments. I have an ex-breeding puppy farm Cavalier, approximately 10 years old, with a grade 5 heart murmur. She quite often rubs her face along the carpet with her back leg, also twitching, particularly when I arrive home. Do you think this is SM?
Hi, Sandra. I think it could be. I'm not sure what you mean by the back leg twitching, but if it's a sort of bicycling action, then and it's associated with that excitement, then that is quite suspicious for Syringomyelia. The rubbing her face, yes, again, but we have to bear in mind that dogs will rub their face for other reasons, such as just having discomfort around their lips.
Okay. From Ross, do you see it reappearing in F2 Cavalier crosses such as Cavachons?
Hi, Ross. Yes, the answer is yes. Really, if you are going to cross a Cavalier to a dog that is smaller than it, then you run the risk of there being a problem, because the brain in the Cavalier is you can think of it as a bit like a hand in a glove, and the glove is too small. And if you mate the dog to a dog that is also too small, then there is a risk that the brain will be super small in that skull. Of course, there's also a risk or a benefit that the dog might not have it. You might breed it out, but we've definitely seen it in Cavalier crosses.
Okay, from Cheryl, is unpredictable behaviour and being reactive outside the house only a sign of CMP?
No, Cheryl, unpredictable behavior and being reactive outside the house can have so many different causes. And that's why it's often a very good idea to seek specialist help with that. I would say unpredictable behavior and being reactive would suggest a fear-based behavior, that they're, for example, the most common one would be reactive to noise. And the most common reason for that is just not being used to having been introduced to those scary things, or being scared by them when they were very young puppies. It's very, very common.
All right. We have a question that we got by private message from a follower. How do they go about finding a Cavalier puppy?
So what I would recommend is that you go about it very carefully. I would suggest, you can see on my acknowledgement board there, you can see the big one in the middle with the pink that's called Cavalier Matters. Cavalier Matters has a wonderful website resource with lots of information about many different conditions, produced in a very easy to read manner. So if you've had difficulty following me, which I completely understand, then that's a good place to visit. And they also have a lot of information on how to look for a Cavalier puppy. And the important thing is to know what questions to ask. Because if you don't ask the right questions, for example, it's quite easy to ask, do you screen your dog for Sphingomyelia? The answer is yes. They don't necessarily tell you the results of the screening for the Sphingomyelia. You sort of implicitly would assume that they screen and they've got a good result. Otherwise, why would they do it? But I can tell you sometimes the answer is yes, they screen, and yes, they've got a problem, and guess who's going to get that problem? You. That's being a bit unfair, but most breeders are trying to do a really good job. But there are some breeders who are trying to be a bit disingenuous to people who are less well informed. Some people just would, some puppy farmers would just downright lie, or not have and not have that information to hand. So it's important to ask the right questions. And the other resource that I would suggest would be to go to some of the websites that will show you other information of how to get a puppy. For example, the Dogs Trust, you can see their symbol there, and the PDSA, and also the Dog Breeding Reform Group, DBRG, have questionnaires that you can fill in that can help know whether or not it's a good idea to do such a thing.
Thank you. Okay, from Emma, how successful is surgery? I know it's not a cure, but will it reduce the symptoms enough for the rest of the dog's life?
So the question is, what are the signs that the dog has, Emma? If we're trying to reduce pain, then there is about an 80% chance that the signs of pain will be reduced. But whatever the surgery is, there's also a chance that the signs may come back. And in the follow-up study I did, in about 50% of the dogs, the signs returned within about 2 years after surgery. So actually, the long-term success for surgery isn't fantastic. But that being said, I've also had dogs which have had surgery, where I've had that lovely email 10 years later where the owner has said, little Charlie was eventually died of natural causes when he was 14, and lived very well after his surgery. So it's some of them can do well, some of them can do very well for a long time, others not so well. I would say with surgery that if the dog is not doing well on medical management, then they may do well on surgical management with medical management. So that's why I tend to use surgery in those respects. If the dog is weak, or if the dog has phantom scratching, then it's unlikely that surgery will be successful. because it seems that the damage done by the spinal cord to the spinal cord is permanent in those instances.
Sorry, these questions are hard to. Oh, okay, yeah. Is there a specific age before they will start to show signs of SM or Chiari?
That's a good question, Shona. It's rare to show signs of pain before 6 months of age, but occasionally you will get the odd puppy which is showing signs of head pain. Most signs come in the between the first year of life and by the age of 4. So it's quite unusual, not exceptional, but quite unusual for a dog older than 4 to suddenly get signs of Syringomyelia or Chiari malformation. So if you have an older Cavalier who suddenly gets neck pain, then actually it's more likely to be due to intervertebral disc disease than it is to be due to Chiari malformation or Syringomyelia. That being said, sometimes I get dogs that are older presented to me, and I look back through their, and as far as the owner's concerned, this was the first episode of pain, but I look back through the history and I just see odd things that might have been a clue, like the yelping when being picked up or screaming when they're defecating, just odd signs. But the answer to your question is really most dogs will show them as young adult dogs, and that's also true of humans. The most common age for presenting with Chiari malformation is in your 2nd to 4th decade.
Okay, this one we can kind of shorten because I think it could be quite a good broad question. When do you suggest the owner sees a specialist to have an MRI? Not sure if this can be one of the symptoms, and do you need to check with an MRI?
So the answer, Ying, is that unfortunately Sphingomyelia can only be diagnosed with an MRI. And that's a big downside because MRIs, as you're probably aware, are very expensive, which means, unfortunately, the vast majority of dogs are not going to get a diagnosis because it's just unaffordable. When we can't afford an MRI, we have to make a judgment on the basis of the number of clinical signs. And that slide that I showed you with the percentages, what I'd really love to do is to make an app. Anybody who's got loads of money and app development capabilities who's listening in, feel free to contact me at this point. What I'd really like to do is to make an app and make little questionnaires and have people answer the questionnaires and give you a percentage likelihood. I think with your dogs of trembling and not wanting to go out, I think there'd have to be other signs that might make me more suspicious that there was Syringomyelia. Things like not wanting to do stairs, not wanting to jump up, rubbing their head a lot. I think just not wanting to go out could have a lot of other explanations that I would want to explore first. You may ask me, oh, Claire, could I just pop the dog on gabapentin first and then see if that makes a difference? Well, it might make a difference, but unfortunately, gabapentin is a bit of a broad spectrum drug and it can also relieve anxiety. So giving treatment trials doesn't necessarily prove that something is a disease.
Okay, we've got another question by a private message. What can we do if we feel that our dog has SM or Chiari, but our vet dismisses us?
Well, it's a very difficult one because you obviously you want to respect your vet, but ultimately, if you really feel very strongly that you have something that is possible, but you are being dismissed, then it is your right to ask for a second opinion. Now, of course, that's a bit difficult because you might feel that you have a good relationship with your vet, and otherwise you think your vet is a pretty wonderful person. But nevertheless, you can ask to see somebody else in the practice, and you can also ask to go to another practice. Now, if you go to another practice, then by law, that person must inform the other practice that you've presented there. And that's really for your own safety so that medical records can be transmitted. But you're basically asked to, ask for a second opinion. That has happened, and other vets who might have a different perspective, a fresh set of eyes, may instantly say, "Oh yes, I think this is the case." The other thing is you're also entitled to ask for a second opinion from a specialist like me. You're allowed to ask for a referral. It doesn't just have to come from your vet, but one does hope that it's a mutual decision from you and your vet.
Thank you. Okay, Kathy, how will we know if we are over-exercising our adopted Cavalier who misdiagnosed with SM, as she loves going out with her two new brothers and we would hate to increase any pain she is in?
Oh, Kathy, your question is very easy to answer. There is no exercise restriction for a dog with Chiari malformation or Sphingomyelia. It's to within their own limits, is what I say. So if she is obviously suffering afterwards, you exercised her too much. But it's not a disaster. You won't have made her permanently unwell. It's just a lesson that maybe next day, if she's very bad after say a 1 hour walk, or a 2 hour walk, or a 10-mile hike, that next time perhaps decrease that by a half and then build back up. My observation is that the fitter the dog is, the better they cope with this condition. And actually being lethargic and, dare I say it, obese or in luxurious dog condition is a negative thing. In humans, when they did a nice little study that looked at all complementary therapy, all manner of things ranging from Reiki to Indian head massage, fewer acupuncture. The one thing that was found to be of the greatest benefit was exercise. And we know this. If we know we feel good, generally we feel good after we exercise, and the positive benefits of exercise are also measured in endorphins and other things. And so, if your Cavalier loves to exercise, then that is brilliant. I doubt you'd make her condition worse. And if she does seem to be a bit worse, then back off or give her some top-up medication on that day.
Thank you. Okay, from Jessica, will early surgical intervention of SMP lessen chance of long-term issues and/or SM development?
That's an interesting question, Jessica, and the answer is the studies haven't been done, although some of them say that that might be the case. The truth of the answer is that when dogs present who are going to get Syringomyelia, then they usually have it already. And so I can't really say that giving the surgery means that it's less likely to progress, because often when you discover a dog has Syringomyelia and follow it over years, it's often surprising how stable the syrinx is. It kind of, syrinx being the short word for Syringomyelia, it seems to achieve a dynamic equilibrium. And so when we do follow-up studies after surgery and show that the syrinx hasn't changed or changed only by a millimeter, then that may be just because that's the way that syrinx is in that particular dog. And there are plenty of dogs that I have operated on with Chiari pain who then haven't got a syrinx, but I don't know that they weren't going to get a syrinx anyway. So I think the answer is we don't know.
This is a good question, actually. Ralphie has been on gabapentin for 4 years for SM and is managing well, but he does have occasional bouts of frantic behaviour, such as digging furiously at his bed or cushions and running back and forth in a manic way. Is he in pain when this happens? And it always happens at night in hot weather. Could this be related to air pressure affecting his condition?
Hi, Julie. It is a good question, and the answer is I don't know. When I think about it logically, I would have to say that running around madly and digging at cushions is not a logical thing to do if your head hurts. And so the logical part of my brain would say that that isn't a pain-related behavior. Although it is possible, I guess if you're very, very distressed, and really don't know what to do with yourself. But I would expect in that instance, for there to be some outward signs of behavioral distress, so vocalizing, the dog looking like they are in distress, having a pain face, that sort of thing. I think if the dog is doing, happy zoomy type behavior, then it's unlikely that they are in pain. One could argue that if you're seeing it, then there's no harm in giving top-up medication during that time and seeing if that makes a difference.
It's something we see actually in the evenings as well with a couple of our SM dogs. So I don't know, the jury's a bit out with it, but certainly like you'll see them doing that and then rubbing their head against the wall or the floor, and I think it may be linked. So, but,
I once watched a television program with a child with that sort of problem, and the child, who was quite young indeed, was rubbing her head on the floor, and it reminded me. And she was verbal, and she did say she had a headache, and it did remind me of the Cavaliers.
Wow. Okay, Larissa, I'm a breeder. What can I do to prevent any puppies from developing this disease? Is MRI in my adult dogs the best thing to do? And if it is, what's the earliest age this can be done?
Hi, Larissa. I'm so glad you're thinking about looking at screening. So it's the best thing to do is to look at the Kennel Club site, the Kennel Club site for your breed, and if it doesn't have it on there, then look at the Cavalier site, and also look at the British Veterinary Association site. A lot of the other sites that I've mentioned will link to there under CMSM screening. The earliest age you can do it from is 1 year of age. And in the Netherlands, however, they will do it twice. And the reason for that is that the prevalence of the disorder gets higher as they get older. So basically, as I said before, if we took 100 Cavaliers at 1 year of age, we might find 25 of them would have Sphingomyelia. I've used those figures because that was the number when we did some screening over a decade ago. And at 3 years of age, 60% of them had Syringomyelia, and it's at over 5 years of age, 70% of them had Sphingomyelia. So the sensible thing to do would actually be to MRI all of the dogs who are in breeding populations at the age of 5 years, and put them into a statistics program which is called Mate Select. And if you did all that and you did all of the dogs, because all of the dogs are related to each other in some way, then so I'd have to say you'd have to have the pedigree information, but that's what the Kennel Club Mate Select program does. If you did that, then you would get a statistical value out of the risk in your dog, even if they hadn't been scanned. That would be the beauty of it. But unfortunately, to do that, you require all of the breeders to scan all of their dogs and also to keep doing it. So the next best thing would be to make a breed-wide policy to do all of the young dogs and rescan some of them, which is what they do in some of the countries. In Holland, they scan them at 1 year of age and scan them at 3 years of age, and they feed that into a statistical program. And that's the country where we're seeing a drop in the incidence. So in answer to your question, the earliest age you can do it is 1 year of age, and that will give you a certain amount of information. And certainly if your dog has Sphingomyelia, then it's not a good idea to breed from them, because there's a very high chance that the offspring, extremely high chance the offspring will have Sphingomyelia. But if they're clear, there is still a chance that they could breed affected dogs, because we don't know their ultimate status.
Thank you. Claire, is 2 more okay?
Okay.
Thank you, because they're quite important. Okay. Do you see increasing cases in other brackies, pugs and Frenchies in particular, and do you see different presentations in different brachy breeds?
Hi, Katie. So yes, we do see Sphingomyelia in pugs and Frenchies. Probably it's a lesser incidence than Cavaliers, and they have a slightly different brain conformation. Theirs is also associated with skull base shortness. They don't tend to have the cerebellar herniation as a common feature. The other thing about Pugs and Frenchies is that they may also have Sphingomyelia associated with their other vertebral malformation problems. So these breeds are the screw-tailed breeds, and they quite commonly get wedge vertebrae, which in the Frenchies can result in a kinking of I'm trying to put my arm in the right direction, a kinking of the spine like that. And that can be associated with Sphingomyelia. And the pugs, you can get a high instance of scarring in the meningeal space, and that can be associated with Syringomyelia. So there are quite a few reasons why you may get spinal problems in those breeds, but yes, we do see it.
Okay, should we make this the last one? Is that
Yes.
right, Claire? Yeah. Okay. My dog is 5 years old and has only phantom scratching, no pain or other signs. Should I start gabapentin?
It's a good question, Teresa, because there is arguments for and against. One of the questions is, are you absolutely sure that there is no pain or other signs? I believe you, but sometimes it can be difficult to be sure. And in those instances, if you're not sure, then I suggest a 2 to 4 week trial of gabapentin to see if it changes your dog's demeanor or personality or activity, see whether or not it has an impact on them. Because if it does, then that kind of answers your question whether or not they should have this drug. If they are only phantom scratching and have no pain, which is possible, then it comes down to, is the phantom scratching impacting their quality of life? And it will do if the only way that you can walk them is on a leash and they scratch when they're on the leash. And there's a surprising number of people who can't free walk their Cavalier, either because they are not in an environment where it's safe to let them off the leash, or because they're worried their dog will never come back to them. But I've seen some dogs with phantom scratching where the owners say that the only phantom scratching they do is when they're excited first thing in the morning, and that the dog runs out on the beach or over the common, quite the thing, and they never see any other signs, and the dog is happy. So that is certainly possible. So those are the 2 questions. Is it impacting their quality of life? Is it impacting their ability to exercise? And is it worth perhaps doing a trial of medication to see whether or not they change and whether you might be missing some signs? Because, of course, gabapentin also has side effects as well. And the sedation from the gabapentin or the appetite stimulation, you could argue that might have more impact than the scratching.
Oh, thank you, Claire. Oh, well, thank you ever so much for helping us. And I think you've, answered so many questions and helped so many people tonight. Really grateful.
Good. Well, it's been a pleasure to be here. Slightly weird just talking to one person, hoping that other people are out there, but I'm sure they are because we had the questions. Yes, I just hope my motivation is just trying to get information out there to as many people as possible, accurate information, in the hope that we can prevent and treat this disease.
Yeah, absolutely. Well, thank you all so much for joining us.
Thank you.